Hello, thank you for viewing this video. My name is Ashley Saab, and I'm a program manager with the New Jersey American Academy of Pediatrics. I'm excited to share about one of our new programs, NJAAP. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It is an approach based on the scientific evidence that aims to identify patients who may be using substances and offers early intervention services to those at risk of developing substance use disorders. This public health approach is designed to provide effective and timely services to individuals who may be struggling with substance use. We want to thank the New Jersey Department of Children and Families for funding this program and providing us the opportunity to share about adolescent substance use and the SBIRT model. The following interview is with an important member of our NJ SBIRT faculty, Dr. Susan Brill Goldberg. Before we get started, I wanted to share that Dr. Goldberg is a practicing pediatrician with over 30 years of experience. She specializes in treating adolescents and young adults up to the age of 25. She is the chief of adolescents medicine at the Children's Hospital at St. Peter's University Hospital in New Brunswick, New Jersey, where she maintains an active clinical practice. She is the clinical associate professor at Rutgers Robert Wood Johnson Medical School and serves as a core clinical faculty member of the Children's Hospital. She also provides clinical instruction for pediatric residents at the Richmond University Medical Center in Staten Island, New York. She is the founding chair of the Adolescents Committee of the new NJAAP and has been a physician champion for several NJAAP projects, including an ECHO program on STD diagnosis and screening. And she is currently now the lead physician on our newest ECHO for the substance use screening using the SBIRT model. So without further ado, we're going to get started on the interview with Dr. Goldberg.
Hi, Ashley.
Hi, Dr. Goldberg. Thank you for being with us here today and taking the time for us just to ask you a few questions about your experience with
Sure.
NJ experts and in the field. Could you give us a brief description of your work experience as well as what motivated you to take a career in adolescent medicine, substance use, and general pediatrics?
Sure. So when I was in my residency training, I really didn't know what I was going to do. I enjoyed all aspects of pediatrics, but I found that I really resonated with teenagers. I enjoyed working with that population. I felt like I could really have a dialogue and a relationship, particularly with the patient, not just with the families. And it was something that I enjoyed. When I took my first job, I took a general peds job and I gravitated towards the teenagers. And I was working in inner city Newark at that time, and the kids really needed a lot of support. And I found more and more I was enjoying the time I was spending with them. And I was asked to run an adolescent clinic. And it really just went from there. I started learning more and more and ultimately became board certified in the field in the later 90s. And in the last of over 20 years, I've been teaching adolescent medicine as well as practicing full time.
Thank you for sharing that with us. What
Sure.
is the SBIRT model and why is it important in healthcare practices in your view?
One of the things I know after working with teens for so long is that they're not likely to volunteer information if you don't ask them. They come in for a physical, how's everything going? Great. How's school? Good. How are your grades? Good. And that could be the whole visit if you don't ask anything else. And when it comes to sensitive topics such as sexuality and substance use, it's important to make sure that teens have a proper space where they can talk about some of their issues confidentially. And this is really where screening comes in. If we can screen kids and identify which of those kids are having issues that really may need further evaluation, um, that's going to be a very powerful tool for us that we can do in a fairly efficient manner. Something like substance use, which is so ubiquitous among teens, when you consider the big three, such as alcohol, nicotine, and marijuana use. If you add up the number of kids that are exposed to those substances, even if they're not actively using it, if they just tried them, it's a lot of kids. And when we use a screening model, it gives us a quick way of assessing, are kids using drugs or alcohol? How much? Is it a problem? Is it something that we can just address ourselves in an office setting, or do they need further help? And by using a tool that's been well validated, it gives us a fairly quick and efficient way in order to separate those kids out that really need more help.
Thank you for sharing that. Can screening for substance use in adolescent patients help create positive outcomes for your patients and families?
Oh, definitely. I've made it a practice over the years to screen patients, particularly for the substances that I just mentioned before, because they're so ubiquitous. And one of the reasons that I went into pediatrics and adolescent medicine is to really do preventative work. So if I, let's say, have a patient that is starting to use nicotine, they may not be addicted, they're vaping with their friends, and I can screen them and find that out and get them to stop before they become addicted and before they develop all the health problems down the road that they may end up with from using those substances. That's a really powerful preventative tool. And my saying, and I tell my patients this all the time, is I want to send them into adulthood as healthy as they can be. And by mitigating the risk or delaying the onset of drug and alcohol use, we can really make a difference in people's lives long term.
Yes, I agree. Thank you. What are some help community resources that you found that make a difference in treating adolescent substance use, meaning like with therapy, counseling, maybe some supportive services?
So it's often a combination of all three. I mean, it's not 100% that kids who are using substances need mental health services, but there's quite a bit of overlap. And by screening, as we often do for depression and anxiety, which may already be built into a lot of doctors' practices, and now also adding a substance abuse screen, we're really getting a broad look at what services kids might need. The first step is usually mental health services. Um, Often, if kids are more involved in substance use, such that they've developed a substance use disorder, they may need more specific services from those individuals that are well trained in substance abuse counseling. And there are a lot of local resources, and that's one of the things that we hope to explore with our ECHO model. And finally, just community resources as well. Getting kids involved in positive youth activities can go a long way towards preventing boredom, particularly when talking about the summer and kids not having much to do. By helping with positive youth models, it can really make a big difference in kids' lives and even put them on track towards a career.
What advice would you give a pediatrician or healthcare professional who's interested in integrating the NJ model into their practice?
So one of the reasons why I thought this program was so powerful is it gives pediatricians a very efficient tool to do that. Pediatricians and other healthcare individuals who are taking care of kids and adults are feeling the squeeze. They're feeling like they don't have enough time to cover all the bases that they need to cover. And by creating a very quick tool that can help sort out, maybe that's one kid in a whole day that has a significant substance abuse issue, or one kid a week. But if they don't ask, they're not going to find that kid. And by doing a quick screening tool, the SBIRT probably takes a minute to fill out and 2 or 3 minutes to talk about. It could be a very small part of the evaluation, but have very powerful ramifications. So I encourage pediatricians to ask those questions and screen, because if you don't ask, you won't know, and it can make a tremendous difference in the long run in kids' health.
Thank you. And my last question would be, could you describe ways you have modeled and encouraged trauma informed care at your practice or in your line of work?
So the whole concept of trauma informed care has been around for a little while. I think it's something that a lot of pediatricians sometimes do, unconsciously. But again, it's also screening for that trauma. A lot of times kids aren't going to tell us about trauma that they've had. So it's important to do that, what we call a heads assessment, ask about divorce, ask about who they live with, ask about domestic violence, ask about personal, either physical or sexual abuse. These are unfortunately common traumas that kids experience, even bullying at school. And if we get a sense as to what their trauma might be, then it may help us understand a more 360-degree view of the patient and then help them get appropriate resources. So, and of course, being sensitive to whatever that trauma might have been.
Thank you, Dr. Goldberg. This interview was very insightful and informative. We just want to end by saying helping New Jersey families through substance use and recovery requires community-wide approach. We encourage community organizations and services to connect with our team to find out the best way to share free and accessible resources with New Jersey healthcare clinicians and their patients. If you would like to learn more about this important work or apply for our NJ Expert Echo series coming this fall, please visit our website at njaap.org/njexpert and join our email list to find out more about future events and opportunities to get involved in. Thank you.